Hi, everyone, and welcome to the Rural Doc Allen podcast. I'm excited to welcome to the program Rural Doc Allen Lindeman. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic, spotting. Is spotting before your period generally something to be concerned about?
Well, it all depends on how much and how often. For example, some women will have a day or two of spotting, and they'll have it fairly regularly. There's nothing wrong with that. However, if you find that you're spotting for more days, 3, 4, 5 days, then you need to be thinking a little bit about not being normal.
All right. Next question. What usually causes spotting before a period?
Well, you can have many reasons for spotting. One of them would be some abnormality of the lining of the uterus. For example, infection in the lining of the uterus. We call that the endometrium. If you have an infection, you may have irregular bleeding and, of course, probably some pain and some cramping. But you might also have a pre-cancer or even a cancer. And that could be the lining of the uterus. It could be cervix. It could be vagina, rectum, or even vulva. So there are a lot of reasons that can be responsible or causes responsible for more than a day or two of spotting.
All right. When should you see a healthcare provider about spotting before your period?
Well, if you find that you have increasing amounts, for example, 3, 4, 5 days of spotting, or if the spotting comes at other times in the middle of the month or, times that you don't expect. So not again, if you've had any pre-cancer or cancer, or it could be that you have some new dysplasia or pre-cancer or cancer. So basically, anytime you are worried or concerned that something is abnormal or unusual, you should call your doctor.
Right. Okay. And the last question is, how long does spotting before a period usually last?
Well, again, if it's physiologic, it's probably going to be a day or two. And as long as it occurs monthly, there's no harm in that. However, if you have bleeding that's associated with pain, fever, or irregularity in the amount or the frequency, call your doctor.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Your Way today, available on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys.